Hi, this is Dr. Desmond White, gastroenterologist and hepatologist. Today, I want to talk about hepatic encephalopathy. In Chinese, it's called 肝脑病. In English, it's hepatic, that means liver. Encephalopathy means something wrong with the brain. We often see hepatic encephalopathy in patients having liver cirrhosis, usually quite advanced. In fact, under the old child pill score, we actually grade encephalopathy with 0, 1, and 2. 0 means none, 2 point being severe, 1 point being in between. So we do appreciate the importance of hepatic encephalopathy. It usually means that the liver cirrhosis is quite severe. So there are two possible mechanism. The first is, our intestine have a lot of bacteria. You have it, I have it. They ferment they act on the bacteria, on the food that we eat, or on the feces in our intestine, and they produce a lot of toxins, including ammonia and many others. And this toxin, we will pass motion, we pass it out. Sometimes the toxin can pass over the large intestine lining, and it will go to a blood supply system called the portal system, and it go to the liver. So my liver and your liver will receive blood from the digestive tract, and sometimes we receive toxin from the gut, like ammonia and other toxin. My liver, which is healthy, will remove the toxin, detox, will change ammonia into urea, and they will then excrete them in the kidney. But in people that have a liver cirrhosis, the liver is hardened, it's not functioning well. When they get very severe and they cannot do the detoxification, and ammonia can go to the brain. So that's one mechanism. The second mechanism is that the liver, when it becomes hardened, the blood can typically flowing back. So the blood have to find other ways to bypass the liver. We call it shunting or collaterals. Okay, so from the portal system, it should drain blood from the intestine to the liver, and the liver detox go to the brain. When the liver is hardened, the portal system cannot push the blood to the liver. They found collateral, they bypass the liver and go back to the right heart, go to the lung, go to the left heart, go to the rest of the body. So in people having severe cirrhosis with what we call portal hypertension, the liver is so cirrhotic that the blood bypass the liver. They can also get ammonia toxin from the blood that are not removed from the liver and go to the rest. So we call it hepatic encephalopathy. In the mild form, patient may not realize that. They will just be a little bit forgetful, a little bit off. When we ask them questions about what you eat this morning, they will be thinking like, can't remember. When you ask them what the 100 minus 7, they say 93. 93 minus 7, then they hesitate. 93 minus 7, 88. I think that's wrong. It's 86. Oh yeah, 86. 86 minus 7, then they blur. So we use this sort of number test to test how good the brain is. Okay, so become very subtle when it's early. They just a little bit off, a little bit slow, a bit forgetful. When they drive, they may bang into people's car more easily. They're a little bit drunk. But when it's severe, they can be sleepy. So I told my patient that if you feel tired, you're forgetful, you feel sleepy all the time, then we are concerned. Okay, so these are symptoms. In a severe scenario, they can become totally comatose. They just cannot be woken up. Then they need to be brought to the hospital for us to start treating. So how do we diagnose it? Hepatic encephalopathy almost always happen in people having liver cirrhosis or have portal hypertension or some shunting. So the blood don't go to the liver, they go around the liver, go to the rest of the body. So they may have this reason. And we check the ammonia in the blood that is often high. Take note that ammonia is not the only toxin that causes the problem. There are many toxins, but ammonia is the easiest to measure. So we measure ammonia. When it's high, then we call it hepatic. In a suitable patient in a setting of liver cirrhosis and portal hypertension, we call it hepatic encephalopathy. When that happens, we can actually make them better. How do we manage? The number one is to treat the underlying liver problem. If they have a liver cirrhosis from hepatitis B, treat the Hep B. They have cirrhosis from alcoholic, treat the alcohol. And after that, we can give them some medicine to take. There's some medicine that will make them flush out the bacteria more often. We use something called lactulose to make them pass motion. We tell them that when you pass motion 3 times a day, let it pass out. When they flush the bacteria out, there are less bacteria in the intestine, and then they make less toxin. The second way to do is that we give them a special antibiotic called rifaximin. This antibiotic will kill the bad bacteria in the intestine, so they make less toxin, less of they absorb, and they are better. But eventually, when they develop the stage of liver cirrhosis with hepatic encephalopathy, it is time to think about liver transplant, because if their cirrhosis is so bad that cause encephalopathy, it's probably time to think about liver transplant. So I hope you learned something from me about hepatic encephalopathy. This is Dr. Desmond White. Thank you.